Hi everyone, Dr. Suneel Dhand, medical doctor. Welcome to another video. I want to go over in this video something very important, my 5 least favorite medications and categories of medications, especially in an older population. I see issues with these medications all the time. Now, if you're not already signed up for my free newsletter, please do so. Link is down below in the description. I talk about these kinds of topics a lot in my newsletter as well. And when I make videos like this, am I saying that everybody who's on these medications, which is lots of people, needs to stop? Absolutely, that's not what I'm saying. I'm merely presenting to you my own experience of issues that I've seen with medications, and it, of course, is paramount that you always speak to your doctor before changing any medication, stopping any medication, and, of course, before starting any medication. So I hope I can empower you with more knowledge of potential problems with certain categories of medications. So let's dive right in. Really important, once more, I see issues with these medications all the time. Number 1, hydrochlorothiazide. This is a fairly common medication that is still prescribed, and I can't tell you the number of times I see issues with this medication, particularly in somebody over the age of 65. So let's back up a little bit. Hydrochlorothiazide is a blood pressure medication. It is a diuretic. In the UK and Europe, more commonly, the medication that is similar to this that is prescribed is called benzoflumethiazide. And the medication works, it lowers blood pressure by making the kidneys secrete more water and electrolytes. So the problems that I see with this medication is firstly a low potassium, what we call hypokalemia. I see people, especially if they start to get sick, become more dehydrated. Their blood pressure might drop by too much. They may become dizzy. So that's the first medication that I'm really not a fan of for those particular reasons. Hydrochlorothiazide, I personally wouldn't prescribe it in an older person. But again, if you're on it or you know somebody who's on it, always speak to your doctor about potential alternatives and whether the problems that I've just mentioned may be a problem in your particular circumstance. Okay, number 2, benzodiazepines, most commonly prescribed for sedation or helping to sleep, can also be used for anxiety symptoms. The most common ones prescribed in the United States, diazepam, also known as Valium, lorazepam, also known as Ativan, alprazolam, also known as Xanax, clonazepam is another one. So they generally end in PAM if you want a basic rule for benzodiazepines. And what common problems do I see? Well, over-sedation. People being completely zonked out because they're on these medications. Maybe they continue at a certain dose, they get older, and the medication starts to affect them more. So be very careful with benzodiazepines. A very common scenario that I tend to see is an older person will start to be getting sick with an illness. They'll be on a benzodiazepine, they'll become drowsy, and they will fall. Number 3, medications for relieving nerve-related pain. The most common one, which I see prescribed, is gabapentin, also known as Neurontin. Related to this, well, I suppose it's more for muscle spasms, Flexeril, cyclobenzaprine. Again, the most common issue I see is sedation with these medications. I frequently can't believe it. I will see a patient in the hospital and they're older, maybe they're in their 80s, and they're on these whopping doses of gabapentin, like hundreds of milligrams 3 times a day. And it's very obvious because often we have to stop these medications because people are already sick and they start to wake up and their loved one will say, wow, we haven't seen them this awake for a long time. Well, yes, because gabapentin is a sedative medication. So I'm really not a fan of it. There may be many people out there for whom it does benefit them. Maybe they're on lower doses as well. So with any of these, I'm not saying you never should be on these medications. I'm telling you the medications that I commonly see issues with, and gabapentin is certainly one of them. Okay, what do we have next here? Number 4, non-steroidal anti-inflammatory medications, particularly in high doses. So we're thinking here medications like ibuprofen. If you're going to use ibuprofen, I would definitely suggest using it at the lowest possible dose, a couple of 100 milligrams as needed. But some people out there, especially people with certain problems like arthritis, are on doses like 600 or 800 milligrams multiple times a day. There are other anti-inflammatories which are often used in oral form like diclofenac. But the main issue I see, particularly with these high doses of anti-inflammatories, firstly, alteration of kidney function. So these medications can affect the kidneys if used for a long time. I frequently see, well, not frequently, but enough times for it to register, I will see an older person come into the hospital and their kidney function is a bit impaired. And we realize that they've been on these high doses of anti-inflammatories for some time. Another issue to be very careful about is ulceration of the stomach and a potential gastrointestinal bleed. That, I would say, is a fairly common scenario in the hospital. We will see an older person who's admitted with a gastrointestinal bleed. They may have noticed bleeding from down below. It may have been black in color. We will draw their hemoglobin and it will be ridiculously low. And then we go back and we realize they were on these whopping doses of anti-inflammatories. So if you need to be on an anti-inflammatory, discuss with your doctor either having it at the lowest possible dose or taking something like a proton pump inhibitor like pantoprazole or omeprazole to protect your stomach. What do we have next here? Number 5, anticoagulants and blood-thinning medications, those that affect the platelets. We've already actually talked about non-steroidal anti-inflammatory medications. Aspirin would actually be one of those. I should have actually also mentioned that as an anti-inflammatory, but sticking with blood-thinning medications and anticoagulants, the most common ones, which we see prescribed now, are warfarin, still used after decades, still certainly has its uses for blood thinning, most commonly for people with blood clots in their history or atrial fibrillation. But the newer anticoagulants include medications like apixaban, also known as Eliquis, and rivaroxaban, also known as Xarelto. Those medications are used much more now than warfarin because you don't have to constantly measure blood tests like INR. And the downsides of these medications are that they can thin out the blood too much and they can cause bleeding. So I've already mentioned that people could come into hospital with bleeding from a stomach ulcer, but you could bleed from pretty much anywhere, or you could excessively bruise, and hemoglobin tends to creep down. So it's very important if you're on any of these blood-thinning medications like warfarin, Eliquis, or Xarelto, to make sure that you're not becoming more anemic and you're not having any type of bleed. Really important, these medications are used more and more. I've made a video before about their use in atrial fibrillation and the risk-benefit trade-off. I'll certainly make another video again, but enough older people, I would say millions by now, are on these blood-thinning medications. Just be very careful, and it's not a bad idea, especially if you've just started the medication, to check a hemoglobin after a few weeks. Make sure that you haven't got any slow type of bleed. All right, I hope that was helpful. Let's go over those 5 again. Specific medications and categories of medications. Number 1, hydrochlorothiazide, used for blood pressure. Number 2, benzodiazepines, like diazepam and lorazepam. Number 3, medications to treat nerve-related pain, specifically gabapentin. Number 4, anti-inflammatory medications, particularly at a high dose. And number 5, anticoagulants, blood-thinning medications. Be careful with all of those. The statistics are absolutely staggering in terms of how many people are on prescriptions. I think right now, over 50% of people over the age of 65 are on 5 or more prescriptions. And it's really ridiculous when you think about it because people are getting older, sicker, being prescribed more. But at the same time, we are seeing more and more diseases and more problems. And it's not uncommon now for people to come in because they've had an issue with a medication which was prescribed as a medication to treat a side effect of the original medications. And some of these medication lists, especially in patients I see coming in from nursing homes, 20, 30 plus medications, it really is ridiculous. And half of the time, half of these medications are not needed. In fact, the majority of the time, a lot of these medications are not needed. We need a complete rethink in terms of our whole paradigm in medicine, and the push should be to de-escalate medicines. Now, am I saying that all your prescriptions that you might be on or a loved one are unnecessary? That's not what I'm saying. What I'm saying is, and particularly as anybody gets older, a lot of medications are not needed and we need to exercise more caution with them because they start to cause problems. I see this every time I'm in the hospital. So I hope this video was helpful. Speak to your doctor if you're concerned about medications, you think you're on too many medications, or you're experiencing side effects. Thanks everyone for watching. I hope this video was helpful to you. Feel free to share your stories of any of these medications or any other medications down below in the comments. Check the links in the description down below for my website and all the other work I do. Also our natural supplement store. If you're in the USA or North America, ohighwellness.com. If you're in the UK or Europe, ohighwellness.co. Hit the like button if you like this video, the subscribe button for more similar videos in the future. And if you enjoyed this video, you will also like some of my other videos on medications to be careful about, particularly as anybody gets older. We will speak again next time.